Hello, this is Miss Gray with part 2 of the lecture on asepsis or infection. This short presentation focuses on the specific nursing actions that you will be accountable for very frequently in your role as a nurse. Some of the content, most of it should be reviewed from your nursing assistant class, but we just want you to focus on it from a higher level as soon to be licensed professionals. So the first concept is to understand isolation. There are measures used to prevent the spread of infection. The concept of reverse isolation is no longer used, and I just present it so that because you may hear it, but reverse isolation was when we would gown the patient up and the healthcare workers wouldn't wear anything. We need to protect ourselves and the patient, so reverse isolation is no longer an acceptable concept. You should understand that the isolation, the protocol for the specific kinds of isolation are dictated by the Center of Disease Control. And as we have learned about nursing standards, what the society should expect from nurses, it's expected as a standard that you understand the protocol for isolation procedures based on this specific illness as directed by the CDC. So your personal protective equipment. So your personal protective equipment are your gloves. Your first round of protection are your gloves. Gloves protect the hands, and you should wear PPE and gloves whenever you're going to come in contact with blood, urine, feces, any kind of bodily fluids that are going to increase your likelihood of coming in contact with infectious organisms. Gloves should be changed in between every client. Never touch with gloved hands what you would touch with ungloved hands. You never want to touch with gloved hands what you would touch with ungloved hands. You don't want to contaminate anything that the patient or another healthcare worker might come in contact with ungloved hands. You always want to wash your hands when removing your gloves, and you want to, if there are imperfections in your gloves, you want to make sure that you take them off and get on another pair of gloves. Never work in damaged gloves. And you must remember that your gloves may become contaminated during the glove removal. So washing your hands and applying the alcohol gel is very important, and you want to make sure you wash your hands after every 8 to 10 applications of the alcohol gel. Your face masks. Face masks are used when you're potentially going to be exposed to or have your patient in contact isolation for droplet. Very often your patients with pneumonia, we've had spent a lot of time talking about pneumonia. That pneumonia is one of the most common illnesses for which your patients are going to need to be in droplet isolation. You also wear masks when patients are in airborne isolation, and the most common airborne organism is tuberculosis. You should also wear a mask when you have a potential for splattering bodily substances. It is important that I mention that the mask that you wear for droplet is different from the mask that you will wear for airborne type of organisms, and we'll talk about that further. Your book says that you need to wear your mask if you're close, if you're within 3 feet of the client. But really, if there's a potential for infection, wear the mask. The book does say 3 feet, but you really want to wear the mask because patients, you hardly ever can go into a patient's room and stay within 3 feet. If a patient sees you and you're a provider, they're expecting that you're going to connect with them, relate to them, and they're going to want to potentially ask you questions. It's almost impossible to stay within 3 feet of a patient once you're in the room. So just wear the mask. There is a special kind of mask called a respirator, also known as an N95 mask. And those masks are for organisms like tuberculosis and SARS that are smaller particles than would be in you come in contact with for droplet. So there's two kinds of masks, one for droplet and one for organisms like TB, and they are different. So you need to be aware of that. The other PPE are your gowns, and they're generally disposable, or if not, they're worn once and put in a receptacle for cleaning by your facility. There are also eyewear, goggles, or face shields that may be in combination with the mask, but they protect you from bodily substances, and they may need to be worn over glasses, and they should cover the sides of your face. Always, always, always wash your hands. Wear clean gloves when touching body fluids. Wear a mask and eye protection when there's a possibility of spraying or splashing. Wear a clean gown if soiling of a uniform is at all possible. Dispose of needles and sharps in a puncture-resistant container. Now, these precautions are going to be on your test, guaranteed. So please make sure you review the reading and these notes and the lectures so that when you come to class, you can ask any questions, because I guarantee you this will be on the test. Number 1, understanding your standard precautions, which are your Tier 1 protection used for all patients in a healthcare setting. It applies to all potential contact with blood and body fluids, except for sweat or non-intact skin or mucous membranes. Sweat is not a bodily fluid, so you won't. But you definitely want to wear gloves when you're treating people with infectious organisms, and wearing your standard precautions are designed to reduce the transmission of organisms and unrecognized sources. So you use your standard precautions with all patients at all times in the healthcare setting, and it applies to all blood and body fluids except sweat, non-intact skin, or mucous membranes. Treat everyone as though they were infectious all the time. So we always use standard precautions. Transmission Tier 2 you always use your standard precautions with all patients at all times. But you may need to add additional precautions to your standard precautions based on the needs of your patient. The 3 additional levels of precaution that you might need to take are airborne precautions, droplet, and contact. And again, these are decided according to the disease and how they are transmitted. And your infection control manual will list the diseases and suggested precautions, and those manuals will be in your facility. So first of all, airborne precautions. Airborne precautions are used most commonly for TB. They include when a patient is in airborne precautions for TB or any similar disease, they must be in what's called a negative pressure room. Or they may be in a cohort with another client that has the same disease, but it's very rare, and I won't ask you that. It's not the standard in this community. In this community, Milwaukee, people with TB get their own room. You must wear a respirator mask or an N95 mask. This is whenever you're going to leave the room. Whenever you or the patient are going to leave the room. The patient needs to have a face mask on outside of the room. When you're caring for the patient, you need a mask on, even if they don't. When the patient leaves the room, they need a mask on. When you are in the room, you need a mask on. A patient with airborne precautions needs to be in a negative pressure room. You need to have the special respirator or N95 mask, because those masks have a specific density to prevent the passing of that organism. So that's very important. Also, the next tier are your droplet precautions. Droplet precautions, when people are in droplet precautions, they need to be in a private room as well. And you must wear a mask when working within 3 feet. But I suggest you wear a mask because, as I've said, it's difficult to remain within 3 feet of a client. And when leaving the room, the patient needs to wear a mask so that they don't expose anyone that they might encounter in the hallway. Your third type of precautions are your contact precautions. And contact means, what will I come in contact with? Will I come in contact with an organism or something infectious? So with contact, you must wear gloves, and you must make sure you wash your hands, and you must wear a gown if soiling is likely. Common infections for which you may need contact isolation would be herpes or wound infections like MRSA or VRE. Again, it's important with your contact to make sure that you wash your hands and to wear gloves. To use clean gloves, change your gloves, and wear a gown if you're going to be come contact with soiling. Also, you want to make sure that you handle your equipment properly, and you dispose of anything soiled properly. Follow the bagging policy of your facility. Always, and this is a very important concept, when your patient is in isolation, they will have a potential for sensory deprivation, and they might feel more bored because they cannot leave the room. They might be anxious, and they might have a loss of self-esteem or inferiority because people have to gown up when they come and deal with them and work with them. So you want to be sensitive to that and realize that can create a need for the patient or an aspect of care that you'll need to address in your care plan. Patients in isolation have a potential for sensory deprivation or isolation, and you and the nurse want to plan in their care methods to address that isolation and to encourage communication. So as a review, isolation are precautions or mechanisms to prevent the spread of infection. You need to be aware of what's needed to maintain good isolation technique, which are your personal protective equipment pieces, which includes your gloves, masks, and gowns. You must be aware and protective eyewear like goggles. That you're always going to wash your hands before and after entering a room. You're going to always protect your eyes and wear a gown when soiling is possible. You want to understand standard precautions. They're your tier 1. They're used for all clients in a healthcare setting. Regardless, it always applies to all blood and body fluids except sweat or perspiration. Perspiration is not considered a body fluid, and I remember that if I were you. Standard precautions treats everyone as though they were infectious, and it's designed to reduce transmission of microorganisms. In addition to standard precautions, there are 3 additional layers that of protection or precautions: airborne for your most commonly TB, droplet, your most common organisms, pneumonia, and contact, most common are MRSA and VRE, and potentially herpes. This is very testable. These are concepts you're going to see very often in your career and in your practice. So it's important to know these layers, and it's important to understand that the psychological effect of being in isolation that can result for your patient, and that you need to address them. That's all for part 2. Make it a great day.